Thank you. Good afternoon, everybody. First one in the new year, 2025, and thank you for participating. So this is going to be a meeting held under Zoom again, originally approved by Governor Baker in 2022, and then extended with Governor Healy, which does expire March 31st, 2025. We'll have to find out about that before that happens. But it is being recorded, as you just heard, for those that just joined, and those will be distributed later for everyone's in the public to hear. So welcome, everybody. Welcome, board members. Welcome, Commissioner and MCB staff, and certainly the public that are on here right now. So thank you for being in attendance here. So let's, first official business for our board members. Can we vote or have a motion to accept the meeting minutes from December 3rd?
I'll make a motion to accept the minutes.
Thank you, Blair.
I'll second it.
Thank you. All in favor?
Aye.
Aye. All right. Anyone opposed? Nope. Okay, thank you very much. I'm going to get that in. And Commissioner, you're up.
Well, hello. Good afternoon, everybody. Happy New Year.
Happy New Year.
And we're off to a good start. And then the budget process has continued. It's keeping me and our budget director very busy, and our rest of our fiscal team. We're working on the FY26 budget, and lots of things are moving on. So lots of action and filling out and completing spreadsheets and all sorts of activities going on here that is keeping us very, very busy. Just finished reviewing and certifying our internal control process. We need to do that on an annual basis. So that is pretty much done. And I'll submit that to the comptroller's office after this call. We continue to manage our personnel, our postings, our human resources needs for the agency, and we are doing well. We have several new staff will be coming on soon to fill positions that hadn't been filled recently or became vacant recently. We have one more retirement coming up at the end of the month, and we'll be having another posting going out for that. And we're working on some other postings just about ready to go out there. So I've been having lots of participating in the CFO meetings, and we have one today at 4:30, always at the end of the day on Tuesday. So they give you a lot to think about when you after you leave the meeting. So and we thought we were close to bringing a CFO on, but the candidate we were working with informed us that there were some personal family issues going on that would prevent them from coming on board. So we have reposted the position. Again, 22 applicants, and it's only been posted since last Thursday, I believe. So we're getting some interest, and hopefully we can come to the decision of bringing a CFO. It's great to have a budget director here, along with the rest of the fiscal team, who is filling in and helping out in some of these CFO responsibilities, and we're doing well. We have received our second disbursement from the federal government. So our VR grant, a portion of our VR grant came in, and a portion of our older independent blind grant and our supported employment grant came in. So this is because Congress reached a continuing resolution that carries funding through March 14th, if I'm recalling that correctly. So therefore, they went ahead and dispersed another portion of money to us. So hopefully when Congress gets together and gets this budget situation squared away, we will probably receive the balance of our funds come March or April, which is good. We are working diligently to manage the funds that we have. We are 95% still using the fiscal year 24 funds. And so we have not, we have left most of our, about 5%. There was some personnel needs that we had to start using some fiscal year 25 funds. But we're in good shape. Everything is going well. We are well funded. All of our programs are running smoothly. There's no fiscal issues, and we continue to work with RSA and reading their memos and making sure that we're all up to speed and managing our grants appropriately. And so everything is looking good. So I can, it's pretty much on the it for the fiscal side of the House. Just before I came on, I received an invite from Governor Maura Healey asking me to attend the State of the State on January 16th. So I guess that's where I'll be spending my evening. And I've responded to the invite, and will be glad to be there in support of the governor. And as we work towards our FY26 budget and continue to progress well here in the Commonwealth. And I'll turn it back to you, Brian.
Brian, you're on mute.
We don't hear you, Brian.
Okay, there we
Justine
go.
is okay. Go ahead.
Sorry, I moved some stuff on my desk, so I forgot I muted. John, earlier early on, I forget now, but we had some RSA issues. Are you saying that basically you inherited some and are they all cleaned up now as far as?
Oh, they're
what they
long been
wanted?
settled. Yeah, we settled those back in. I think they were settled back in May, June.
Yeah.
There was some a small issue that was there, and then the bigger issue was that they assessed us a $1.4 million reduction in the FY25 fiscal year funding. So what we did is we managed the money so that we stretched the FY24 funding to go as long as we could, and matching that with the Social Security reimbursements, we were able to stretch that out, and there was no impact at all to our client services. Just let me remind you of this also. Just in the past 2 weeks, we received right around $350,000 from our Social Security reimbursements, which we have taken the $350,000 and moved $350,000 from the FY25 grant away from the programs that we were funding, and substituted that with the $350,000 that we just got from the reimbursement from Social Security. And therefore, that's going to allow us to stretch the FY25 funding even more. And we continue to pursue this. The team just filed another claim for another $46,000. And again, I'll remind the folks that these are the reimbursements that we receive when MCB does successful placements and consumers come off Social Security or SSDI, and the agency is compensated for some of the money that we use from the VR grant to help them obtain skills that allow them to obtain or return back to work. So we continue to pursue that, and that comes in very handy. We just can't plan on that because sometimes the claims get denied or get there's more clarification. So we can't plan on the money coming in, but when it comes in, the rules say that we have to spend that money ahead of the VR grant that's already in play. So we basically, when I said we moved the money away, we moved the VR grant money away from those programs and funded them with these funds that SSA sent to us, so that we can go ahead and spend those first and follow the rules of the program.
Well, thanks for that additional clarity, but I wanted to just make sure for RSA's perspective, we're in good graces with them, and going forward, we're in good shape.
Yeah,
All right,
they've closed all those questions they had, and we're good to go.
Excellent. All right, well, thank you very much. Justine, would you like to present, please?
Yes, thank you. We have some pretty exciting program updates for you. Our orientation mobility team has been actively preparing to host a virtual town hall this spring. I believe this is something that they've done a few times in the past with various different topics. This topic is going to be guide dogs. The title, I think I have to share because I love it, but they're still working on it, but it's Unleashing Potential, the Role of Guide Dogs. So they plan to do, planning is still in the works, but really an overview about orientation and mobility and the role of O&M in the guide dog process. They also plan to have a representative or two from a guide dog school. That's still being worked out, so I'm not sure which schools, but and then really to have some speakers and some testimonials from current guide dog users, and also a Q&A session. So we're looking forward to that. It will be open to anybody interested, and of course I will share the details as soon as they're finalized. I do believe it's going to be late April, but they're in the planning stages. So the O&M team is also preparing to conduct a variety of human guide trainings. Again, this is something that I believe they do annually, where it's really a train the trainer model, where they train teams in 4 regions. So I believe it's Central, Metro West, Southeast region or area, and Western Mass. And the groups that are trained at these are then, essentially the experts, or able to train others at their place of employment, whether it be, a residential facility or a skilled nursing home facility, things like that. So they have those planned for this spring as well, and a little bit into the summer. So members of our vocational rehab team are kind of putting some of our internal finishing touches on preparations for the spring conference. This is the Visions of Collaboration Conference. It's set to take place at the end of March. And this, I believe I've spoke about this in the past, but it's an event that's primarily aimed at TBIs and orientation mobility specialists, or professionals who are working with youth aged 14 to 22, generally within the school systems. So we're looking forward to that, and it will feature speakers and also kind of some vendors with informational tables, and sharing information and services that are generally offered to youth and young adults of that age group. So our employment services team has also been working really diligently on recruitment for the summer 2025 internship program. On a freezing cold day like today, I thought discussing a summer program might bring us all a little warmth. So I'll also just shamelessly plug that, the program, and if anyone has any anyone that they know of interested in hosting an intern or is interested in hosting an intern themselves or knows any businesses or agencies that might be, I just encourage you to please reach out to Carol Collins, our employment services supervisor, or feel free to contact me directly and I'll happily connect you with Carol. Last year we had interns at a wide variety of organizations, tech companies, restaurants, National Bureau of Press. I mean, Carroll Center, Perkins, many, many, many locations. So they're diligently working on that. And those are the updates that I have for you this month.
Thank you, Justine, and you can put us in for it again. We'd love to do it.
Perfect.
I'll be
I think I
informed
already
about it.
did before you said that. So
I'll be being efficient instead of chasing emails and stuff. Just put us in. That'd
Thank
be
you.
great.
I
Yeah.
would be interested in that as well, Justine, and I can
Okay.
shoot Carol off an email.
That'd be
The only thing is it would be a remote position, so I don't know if
That's fine. Yep, that
Okay.
works for some. Certainly,
Okay.
we're open to that. Absolutely.
Okay.
Thank
Cool.
you.
Very good. And
Thank
Carleen, good to see you. I know you joined earlier, but I wanted to recognize you. Thank you for being here today.
Thank
Very
you.
much.
I apologize for being a few minutes late. I joined the wrong Zoom, so sorry about that.
It's a new year and new Zoom, right?
Yes.
There we go. All right. Nate, would you like to give us some updates on the dashboard and your registrations and everything?
Yeah, sure. Good afternoon and Happy New Year to everybody. I will share my screen here real quick. So, as we mentioned last meeting, we've moved to the data dashboard, and most of that data is on the dashboard now. We did discover when we ran the dashboard the day after New Year's here, it calculates by year for some of the things. So it only had very small numbers. I was like, why are the numbers so small? It's like, well, it's only had a few hours since we've started the count here. So I do have the totals for the end of the year as well on those ones that have the small numbers, so I can share that with everybody. So currently for open cases, we have 869 SR children open and 3,365 open SR cases. For the VR youth, we have a total of 215 and 758 for VR adults currently open. For closed cases, as you can see here, we only have 10 SR adults closed, but that is as of the morning of January 2nd. We actually ended up for the year of 2024 with 2,313 closed SR cases. And for SR children cases that were closed was 131. So most of those did move into VR cases. VR demographic information, no changes really there, no big changes. And for the year for new registrations, we closed out the year at 1,819 new registrations here at MCB. We gave out close to 8,600 certificates of blindness throughout the year and close to 1,200 MCB IDs for the year. So new highs for the certificate of blindness and MCB IDs. So those continue to get out to folks as needed. And the registrations came in a little bit above last year, so we're happy to see that too. We are planning on sending out a communication to providers in the next month or so, just reminding them, their duty to register people with us that reach that threshold of legal blindness in Massachusetts, and also to introduce, we will be starting a new lead for the registration team at the end of January. So the letter will come out from that person, and it will be kind of their introduction to the providers and starting that relationship too. So we hope
Hey,
that
can
letter
I-
goes out early February.
Hi, Nate. Sorry to interrupt. So can you remind me, I should know this, but I'm not sure. Do the COBs expire?
They do. They expire after a year. So
1 year every
they're- yep.
time?
Yeah,
Okay.
they're good for the calendar year. We will get an influx now, being a new year. Some people like just to have it ready to go. The real big push around COBs is around tax season. So from June to August, we get a big swell of requests that come in at that period of time.
Okay. Yeah, I know I asked that before, I think probably even, but I wasn't sure if it was be longer than a year. Okay.
Yeah, it's a year. The IDs are good for 5 years.
Okay. Thank you.
You're welcome.
Nate, how are they processed? Because that's a lot of requests, obviously, over 10,000, really.
They're processed in a few different ways. I would say 95% are processed through the registration team. Requests that come in either through email or through phone, or some come up through staff, and then they're printed out and mailed or emailed depending on what the preferences of the consumer, and we get them out that way. I think a little bit the numbers have gone up because we've gotten more email addresses over the last 5 to 10 years, and more people are receiving them via email, so they're a little bit easier to get out and quicker. But it's primarily one person that does all of them. We have obviously backups and people that can step into those roles. Most of the case managers, directors, and supervisors also know how to produce a COB, and can do it in the field as well. So that happens as well. And then the count is doesn't capture all the ones that are produced in the field. It captures the ones that go through the registration. Yeah.
So you said, Nate, that this was a pretty high number for the year, the COBs.
It's a new record. It's probably a few hundred more than last year, but I feel like every year we kind of establish a new record. But that's good. It means people are using them. The information's getting out to consumers that that what they're needed for, and folks are requesting them and using them. So it's a good sign for sure.
Yeah, I was wondering if it was also just with age-related eye diseases and more people having that increase as well, and not just the word out, if it was any trend.
Yeah. I mean, I think people coming in new with their own homes. It depends on how many of them own homes and stuff. We're not seeing a big increase in registrations, so not to really justify the number of COBs that are going out. I think it's just more education that goes out to consumers.
Okay, very good.
What is the number, Nate, that you're speaking of?
The number of certificates of blindness that go out.
Yes. What was
that number?
Yeah.
The number was we did 8,588 this year.
Holy cow.
Yeah, quite a few.
And is there a reason why it's only got a 1-year expiration?
I think it's because of tax abatement purposes.
More of a government thing?
Yeah, the ownership of homes, ownership of cars, obviously that changes from year to year. And we had at one point talked to the assessor's office and like kind of sharing our registry and that information to kind of not have to do that process. But we weren't comfortable with where the data security was. So we pulled back on that and we continue to do this process. We're still talking about that maybe in the future to be able to do that. And that would cut way down on this, obviously, but that's a project that's, way down the road at this point.
Yeah.
Well, thank you.
Brian,
I can say it's a highly efficient system, Nate.
It is.
The certificate of blindness, they come back really quickly. So kudos to the team that's handling all these requests.
Yeah, absolutely. And they're doing a wonderful job, Blair. And it's, it's a lot of organization, a lot of communication that, helps us do it. We also send them out. One thing we found out that we send it out in a different, we found that we're sending them out. A lot of people weren't getting them. When we mailed them, we changed it to we send them out in a blue envelope now. We let them know like, hey, it's going to be a blue envelope. That's helped out quite a bit in kind of cutting down on that as well. And the number of ones that we're actually printing and sending, because years ago we were finding that we were sending 2 or 3 sometimes to the same person, and that's really kind of been cut down at this point.
Yeah.
Can I ask another demographic question?
Oh yeah, absolutely.
Which way you might not know the answer, obviously for a lot of reasons, but so of the population in Massachusetts, how many do you think, or that we know of, are defined as legally blind in the population for the whole state now?
What percentage are legally blind in the whole state?
or yeah, or number, if you had the number, you know, I don't even know how many, what do we have, 6 million, 7 million people in the state? I don't even know anymore.
Yeah, I can look that up real quick on Always State, but I know on our registry right now, we're right around. We just did a big cleanup of the registry and we did a death match and removed a bunch of people that have passed. And I think we're right around the 27,000 mark for people that are currently registered in Massachusetts. So
I just wanted a rough idea. Yeah, I was just curious.
yeah, and it probably wouldn't take me long to look up the population of Mass for you.
Oh, I could do that later. I didn't mean, I was just thinking out loud.
It's
I'm not
almost
trying-
exactly 7 million, Brian. 7.001 million from the last census.
That was a good guess then. Okay. All right, thank you. But I was just curious of like, if we have, you know, just under 8,600 for COBs and what was the total, you know, 27,000. So I was just curious how many were registering and stuff.
Yeah, we're close to getting to that 33% of mark that are receiving the COBs. So it's interesting.
Yeah, thank you very much. That's great.
You're welcome.
Any general other questions from our board members first? And we can certainly go to the public right after that, or comments, either way.
Just Nate, I'm just wondering, you know, it's a shame that there's so many duplicates because we as visually impaired individuals, you know, maybe even a blue envelope might not be helpful. I wonder if there's a tactile type sticker that has our logo or something that can be placed on our hard copy mail that is sent to us that definitely recognizes that it's from MCB. Or something that might be tactile on the envelope that may be even more helpful than something that's blue in color.
Yeah, absolutely, Blair. Obviously, blue is not solves all the issues, obviously, with visual
Right,
impairments.
yeah.
But I think that's a great idea. Something we can definitely look into, and pretty easy to stick a sticker on there for sure.
Yeah, just something that's slightly tactile. We're usually very sensitive with our fingertips and can pick
Yeah.
up on something like that, especially if we know to look for it.
I
So
appreciate that suggestion. Thank you.
the other question I have for the group, and thank you for your report, Justine, is would there ever be an interest? I'm always interested in bringing the visually impaired person community together through MCB. And I love the idea of the April meeting. And would there ever be a possibility of MCB hosting a virtual, let's say, town hall meeting for our VIP community, maybe on a monthly basis or every other monthly basis? There's just so many interesting topics that we could learn from, you know, the importance of being part of a support group. Or I love the idea of training the sighted guides.
So we've done
I'm doing
those.
that every day. So, yeah.
We've done those, Blair.
Are they on a regular basis or
They're
virtual town halls?
it's 2 or 3 a year. So
Okay.
this April one is the first one that's being developed, but there's some other ideas that are being kicked around. We did one on the MBTA and all their different types of programs for folks with disabilities, the paratransit and system-wide access, and different projects they're working on. So that was very well attended. You know, so they're general topic type things. Yeah, we intend to continue to move those forward and do 2 or 3 a year. It's just if you do them too often, we've noticed that the attendance drops way down, and 2 or 3 seems to be the number. I mean, we've gotten as many as close to 300 individuals in some of these meetings in the past. So we think that's a good number. And no, we'll continue to develop topics of interest and to the general visually impaired community, blind community, and we'll definitely work on those ideas and get them out throughout this year.
Okay. Well, thank you for your consideration. I just think there's, you know, trying to get everybody together on a monthly basis or every other monthly basis, first Tuesday of the month or something, in the evening, something that's a regular schedule thing, I think helps our community to communicate with MCB, MCB basis on a regular schedule.
Well,
That's all.
we have our support groups that meet on regular schedules, and many of the consumers go to those that handled through MABV, and some of our staff attend those. And we have our web page that many folks in our media channels, many folks visit and follow and send comments through to us. So yeah, it's good to have a variety of different ways to reach out to the community and bring them together. We visit the Bay State Council Convention, and Justine and I, and we will visit the NFB convention. So I've been to a couple of the support groups, and I'm sure throughout the year that Justine or I will go out again to some other groups. So always trying to definitely stay in touch with what the community is doing, is interested in, and so that's we definitely want to stay in contact with the community. And yeah, we'll definitely, if anyone on the board here or anyone in the audience has any ideas of programs you'd like to see, send them along to myself, or send them along to Brian. You can pass them on to Lucy and myself, and we can see what we can do about getting something together. It just has to be a general topic. Again, we like to get it's a lot of work that goes into pulling this together, and a lot of people sort of set their time aside, and we like to get topics that really bring a good number of a number of people in the audience to it, because those are the people that are also going to help us spread the information. So the more we get to attend, the more ambassadors we have out there going and tell the community about MCB or about the different programs we brought on to that event that day.
Perfect.
Very good. Thank you. That's a good idea.
I had a
And
quick
it
question.
might pair in some way where if we had a special event like that for a purpose, that we would be one of the ones where we have our MCB SAB meeting before that or during that day or something, and have it in person. There's different things we could think about that we talked about before. So keep that in mind too, everybody.
Could work.
Yeah, maybe. Okay, very good. Any other comments from the board before we go?
I had a quick question.
Go ahead.
So I want to apologize, John, because you probably already explained this. I just jumped in a little late, but I just want to make sure I understand it correctly. When you talked about Social Security Administration putting funding toward organizations that hire people who are blind or visually impaired after coming off SSI or SSDI, is that what you were saying? Just to clarify that a little bit, because I was just wondering how do they determine how much money goes to the agency? And
all right, so it's a very complicated formula, so I won't get into that. But basically, if someone let's say it's a client is receiving SSDI or SSI, and let's say they're 40 years old. And they go to work, they get a full-time job. Then they work there 9 months, they achieve their substantial gainful activity, and then they keep that job. 12 months comes around, and they come off the DI benefits. And so therefore, I think the formula is there's some calculation that goes on between, say, now and the expected retirement age. Let's say it's 65. How much money would they have saved? And how much money did the organization spend, the vocational rehab agency spend, to get them back to work? And that's who the holder of the ticket is. It's a whole other complicated ticket program. It can be private entities, it can be networks, but in our case, it's MCB. We'll keep it simple. And so therefore, we have a record of how much money we spend on each individual. So some individuals are registered, when they're young. So they go through college, we support them through that. And then some other programs, or some rehab programs, and some other, whatever it takes to get them to that point where they go to work. The cost of assistive technology, the cost of rehab engineering, the cost of mobility training, all those sort of services are tallied up. And then however the formula is worked out, the agency receives a portion. So the one that we just filed, it was a $46,000 payment to the agency. I've seen payments as high as $120,000. And I've seen this payments as low as $10,000. So if the case is only open for a short period of time and we don't spend a lot of money, then obviously the reimbursement is going to be a lot less. So it does not matter to the agency. Clients get what they need. They're going to get what they need. This is just, I only really bring it up because it's the way that I'm using to help manage and stretch out the budget that we have, the VR grant that we have. And so that's really why I really mention it. It's a small amount of money. It's less than $500,000. I think last year, FY24 or 23, it was somewhere around $500,000. So this year we're headed towards that already. We just collected $350 for fiscal year 25, and we just put another request for $46,000. So we're headed towards that $500,000 mark again, and there'll be a few cases. So it all depends. It's very hard to predict when the consumer is going to hit the substantial gainful activity and what happens there. So,
but this is for selected. It's not an automatic. Agencies are like organizations are entitled to this.
Nothing's automatic. You have to apply. You have
Yeah.
to follow all the guidelines.
Yeah.
If you make one mistake, they kick it out.
Yeah.
If you file not within the wrong period of time, it gets kicked out. Believe me, it becomes like you're jumping through hoops to make sure you get everything right. But it isn't guaranteed. But it is guaranteed if the agency is the one that's holding the ticket and we are doing VR and the client comes off that, the agency has to file. If the agency doesn't file, nothing comes our way. So we have to follow all the procedures to go down and get those funds.
Okay, thank you.
Yeah.
Anybody else from the board? Okay, well, let's open it up to the public. Are there anybody in the general public that would like, you can raise your hand if you can, or, I see hands up already. Hold on one second. I don't know who was up for a Sharon. I'll take you, I guess, for this one.
Hi, just a note to Justine regarding the working with training mobility. If we can be of assistance at all in the Central Mass chapter of Bay State Council of the Blind, if you need input from end users of the mobility services, please let me know. We have a really excellent instructor, and I'm sure that there would be people that would be willing to help with that if that would be of help.
Excellent. Thank you so much for that. I'll pass that on to Allie, who's our Director of Orientation Mobility. She's mainly overseeing that, but thank you. I will absolutely pass it on.
And my other comment to Blair's comments about having topics, even though they're not MCB related, keep in mind that the American Council of the Blind has extensive community calls every week on all kinds of topics. And so if you run into anyone who wants to become involved in either social calls or technology or whatever, if they send an email to community@acb.org, they can get the daily schedule of the events. And they're very good.
Excellent. Thank you.
Thank you.
Good idea, Sharon. Thank you. Nona, you're up.
Yeah, thanks. I have a question for Justine and then just a comment on something that was brought up, I believe, in the December meeting. So my question to Justine is, with this guide dog event that's coming up, I'm just wondering if MCB has plans with the new technology that's coming up, specifically with the glidance mobility device as well as the WeWalk cane. I'm just wondering if there's plans to also do training for your O&M instructors to help the community with those kind of mobility devices that are coming.
Yes, absolutely. Ally, has spoken to this, I think, as well. So we do have plans for that, and some of it's on a consumer by consumer basis, of course. And so the orientation mobility specialist who may work with a consumer who has purchased one of those on their own, we have the option to potentially lease or rent one, or, to be able to have our orientation mobility specialist become familiar with it so that they can assist with training. So, yep.
Great.
Ally she's on that.
Oh, great. Thank you. And the comment that I had really is in regard to the public meetings, this meeting in particular. So I know that as a member of the public, I'm in Worcester. So for me to come into Worcester, to come into Boston for a public meeting it's a 3-hour commute for me for something that may be a half hour to maybe 45-minute meeting. I don't think that's really realistic. And quite honestly, we have this technology and our community has become very comfortable and very happy with having the ability to, remotely come to these meetings. So I think in the future, whether you decide to have some meetings public, there has to be a virtual, there has to be a hybrid component. So I hope that's something that, you will consider, because from what I understood from the open meeting law, if it is a meeting that is in regards to disability issues or accessibility issues, there should be and will be, I think going forward, a hybrid component. So I just kind of want to put that out. Not everybody, can take off that much time during the day to come in for a meeting in Boston.
Thank you. And I'll just add, I mentioned last time the idea of having an in-person meeting at some point. We not every month or anything like that. It was all because of this deadline of March 2025, when we either have to update this to, through the governor's office or whatever to make it extended. But
Sure.
even if we didn't, and we had some special event or something we want to do that was a little unique to have people in person, I like that from a community point of view still. Obviously, it would be planned way ahead of time. And yes, we still could have a hybrid component, I should think. I'm not the expert on all this yet, but I understand your reasoning, and so noted. Thank you.
Thank you.
Thank you, Nona.
Yeah, I appreciate that input as well, Nona. And I held a hybrid meeting recently, and I will tell you from my experience that it's not as easy as it sounds. So definitely, because you really want to be accommodating, right, to your remote participants as well. So to do some planning and research and practice dry runs and things like that to really pull it off. And then just like with Zoom and everything else after COVID, you get used to it, and then it becomes second nature. But there is a little something to it to ensure full participation for everyone.
Sure. And I know that the deadline is, at the end of March, but I know that there's a lot of consumer groups out there, not part of the disability community, but just community groups that are really working towards having this become permanent legislation, or certainly having it extended again. So I think it's here to stay, and I'm actually glad for it. So thank you.
I am too. Thank you, Nona.
Anybody else? Oh, I'm sorry, there are others. Bruce, you're up.
Oh, there are a couple of chats here as well. Did you see those, Brian?
I was reading one just a minute ago, and
Thank you. Okay.
I saw Dennis had one. I can read this, and Nate responded to that. I can read them out loud for others if we like. Dennis asked, out of the 6 regions, which region has the highest population of blind and low vision? And Nate responded, the number of consumers located in each region is relatively close. The big difference is the size of the territory the region covers. For example, our Boston region covers the city of Boston. Our Western Mass region covers 101 different cities and towns. Region. Asterisk. You clarify yourself better than I would. But anyway, that was the text there. Anything else you want to add to that, Nate? I'm not trying to interrupt or read for you.
No, nothing else to add. It's just, yeah, the numbers that we have for the regions as far as the consumers we served is very similar because of the structure of, each region having a director and a certain amount of workers and those type of things. But the size of the territory because of that is different. So Western Mass covers 101 regions and towns through 4 different counties, but Boston's just Boston. Then we have the Southeast, Northeast, the Worcester region. So there's the greater Boston region. So it really just depends on, the numbers are very similar depending on the region, but the sizes are greatly different from region to region, territory wise.
Right. Bruce, you're up. Before I do that, Sharon, I don't know if your hand was still up or if I'll get back to you after Bruce if it's a new raised hand.
No, I'm sorry. I didn't lower it.
Okay, no problem. Go ahead, Bruce.
Thanks, Brian. And I don't know if this question is better directed to Nate or to John, but when we're talking about these certificates of blindness, is there any thought of making that a totally automated process where somebody could order those online and be able to download a PDF version of it? It seems like that would take away a lot of the manual handling that's currently required to produce these for so many consumers.
Yeah, we have explored that, Bruce. We used to just mail them out to everybody, and then it created a lot of confusion and people that didn't need them, and obviously not everyone needs them. So could be a little bit of a waste of resources there. And as far as there is, like, you can request one online now, and we'll send it to you. It's not automated though. I think the cost of automating something like that would be significant, unfortunately. And it's working now. It is a lot, and the volume is a lot, but it's not overwhelming in any way right now, and it's something that we can handle. And if something changes where it gets to that point, we can explore those options. But I think things are working pretty well with it right now. But I do appreciate that thought. But it is something we've looked at a few different times and tried different things, and we've kind of landed where we are now is kind of the best process for the resources that we have currently and the best practices.
And I appreciate that, but I think when you're up to the numbers that you're talking about, if I remember correctly, over 8,000 requests, that seems like that's a lot of man hours that are being put into the production of those, and whether it's mailing or just manually doing emails back to people. So I would just encourage MCB to always look for tech solutions that might make it a more efficient process.
Thanks, Bruce. I appreciate that.
It's a great question, and I appreciate the suggestion, Bruce. So I'm a licensed optician, and we have a new, we moved to the Department of Public Health, our board. And now when you renew your license each year, you have the opportunity to print out your new Wall State license certificate. And that's been a great help to the professionals to be able to have that access. So the technology is there. And I understand Bruce's suggestion, because if you have 8,000 requests annually, that's a lot of work. So
is there some kind of verification issue that are concerned that would be needed? If you're obviously already licensed and renewing, it's different from somebody that's new. That's why I was asking from an AI point of view for making sure that works. Is that anything of concern?
well, we all have an ID number. So
Yeah,
no, I'm talking about general public asking for a COB or something.
But Brian, this would be you have to be registered already with MCB in order to get a certificate of blindness.
I thought first time you're trying to do both online, Bruce. I thought you meant like brand new.
No, this is when you annually need one.
Oh,
for
yeah.
your
different.
tax abatements and things like that.
Yeah,
exactly.
I thought you meant even for a brand new one, trying to get their first one. That's why I was confused.
No.
Okay, well, thanks. Any other, I don't see any other hands up. Any other questions, or I'll check the text line. I wasn't paying attention to that. I think we're there. Anybody else? No? Well, thank you very much, everybody, and we'll see you in a month for those that can participate again. Thank you. Have a good day.
All right, you too.
Thank you. Great meeting, everyone.
Take care, everybody.
Take care.